Let's move on now. New modelling by the Pharmacy Guild suggests some 660 pharmacies will be forced to close because of the government's planned 60-day dispensing policy. If that was the case, what would this mean for services?
Well, it means that we're going to have less services and in fact, they'll be more expensive. I mean, we all want cheaper medicines, but unfortunately what this government is asking small businesses, community pharmacists to do is pay for it. And unfortunately, this means that their model, their business model, is shot. And you see that over 600 of them will close, over 20,000 jobs will be lost. And when you look at, there's over 300 communities that only primary care is a pharmacist, will potentially be gone as well. This is a perverse policy that will hurt regional Australia, but will also hurt metropolitan Australians. There's a sensible way through this. They haven't engaged properly with the Pharmacy Guild. They've only engaged with the big corporate pharmacists rather than actually going to the representative body. I mean, if you want to change resource policy, you don't go to BHP, you go to the Minerals Council. And unfortunately, what also hasn't been looked at, and this government hasn't even modelled the implications on this, on communities and on healthcare, but this is a feminised industry. This will have disastrous impact on women around the country. One in which I thought this government had, through the Prime Minister and Cabinet, had a policy of overlaying all their decisions through the lens of what that will do to women in the workplace. This will destroy livelihoods, not just of pharmacists, but also their workers, which is in a feminised industry. And I'm just concerned that this has been ill-conceived by Mark Butler, but unfortunately, community pharmacists who are small businesses will face the full financial brunt of that, but the community will face the health brunt of it. And that is not a great outcome for this country. And it's time for the Prime Minister to intervene and to stop this policy and to go back to the drawing board.